Tonight, we continue our series, Miracles of Tiny Babies and Their Survival. Now, it focuses on the neonatal intensive care unit at Intermountain Medical Center. Good For You Surae Chinn joins us now with part 3 of our series. Surae.
Well, Kim, yesterday we introduced you to the triplets born at the NICU. Tonight, we look at the team of nurses and staff who keep these tiny babies alive. A big part of the team are the parents who learn how to take care of their babies who are not ready to go home yet. Out. The nurses and staff work as a well-oiled machine, even with multiple births at the same time. The Peterson triplets are getting stronger each day with the help of the NICU staff.
The first week to 2 weeks of life, where it is touch and go and things are changing on a minute-by-minute basis, and very commonly we'll have several nurses at the bedside.
37-0 is perfect.
You're feeding now. Is it not good?
It was a smooth birth for the triplets born between 3 and 4 pounds. Still, the babies need 24-hour care in the NICU for 2 weeks, but some babies spend far longer.
Today is her due date.
Kristie Alexander has already been out of mother's womb for 2.5 months. The NICU is all tiny Ruby knows of the outside world.
I'm preparing the bath for little baby Ruby.
The nurse and staff teach parents how to take care of their fragile baby while in the NICU.
I would use the toothbrush, some soap on the toothbrush and kind of scrub her head a little bit.
Okay.
That'll help.
Baby Ruby, born just over a pound at birth, is now 4 times her birth weight. Kristie Alexander from Kaysville takes extra care, cleaning her daughter, scrubbing her head, cleaning every crevice.
I like giving her a bath just because it feels like something normal you would do at home. And, you know, when you're in the NICU, nothing really seems normal when your baby's hooked up to wires and stuff.
In another room, Molly Rogers from South Jordan bonds with her baby.
It's pretty awesome. We love it.
Technology keeps them alive, but there's nothing like the human touch.
They've done MRIs of moms holding babies skin to skin, and they show that their synapses are connecting really fast, that they're actually physically growing and developing neurologically faster.
Born at nearly 30 weeks at 4 pounds, little Henry has had many ups and downs. In the middle of our interview,
he's not happy now.
Little Henry's heart rate drops and has trouble breathing. His coloring is off.
He is a little dusty.
A nurse is always by the baby's side for just such an emergency.
It's just part of an immature nervous and respiratory system.
After some intervention, more oxygen, a back rub, he's back.
There you go. They're pink. Every time we're like, oh, we could totally take our kid home, you realize there's a reason why he's in the NICU.
Meanwhile, in another room, the Petersons get the news they'll be taking all 3 of their babies home. That's coming up tomorrow. Also, we focus on the nurses and staff at IMC's NICU and volunteers who make up a big part of that team. Reporting in the studio, Surae Chinn, Good For You.